Understanding Childhood OCD. Welcome to Seeds of Tomorrow, where we explore essential childhood development topics backed by psychology and research. Today, we are addressing an often misunderstood but crucial topic in child psychology: obsessive behaviors and OCD in children. Many parents notice repetitive behaviors in their children, but struggle to determine whether these habits are typical developmental patterns or signs of a deeper issue. In this session, we will examine the root causes of childhood OCD, discuss practical strategies for managing obsessive behaviors, and equip parents with science-backed tools to support their children in overcoming compulsions and anxiety-driven habits. What is childhood OCD, obsessive-compulsive disorder in children? Manifest as intrusive thoughts and repetitive behaviors that interfere with daily life. Unlike simple childhood routines, OCD-driven behaviors persist despite efforts to stop them and often stem from anxiety. Common OCD symptoms in children include excessive hand washing or fear of germs, rigid routines such as needing items arranged perfectly, repeating actions like touching objects or checking doors to prevent perceived harm, and constant reassurance seeking from parents. If left unaddressed, OCD can disrupt social interactions, emotional development, and learning. But with the right approach, parents can help children manage and gradually overcome obsessive patterns. Why do some children develop OCD? While OCD has a neurological and psychological basis, environmental triggers and upbringing also play a role. Genetic predisposition plays a role, as OCD may run in families. Stress and anxiety caused by major life changes, school pressure, or family conflicts can intensify compulsive behaviors. Overprotective parenting can reinforce obsessive habits. Some children experience heightened sensitivity, leading to fixation on cleanliness, order, or patterns. Understanding the root cause is essential for developing the right intervention strategies. How is OCD different from normal childhood habits? Parents often ask whether their child's repetitive behavior is a normal habit or something more serious. Temporary routines such as organizing toys a certain way or repeating words tend to fade naturally over time. However, OCD symptoms persist and interfere with daily life, and children experience intense anxiety when they cannot perform compulsions. One key sign of OCD is whether the child experiences distress if they cannot complete a behavior they feel is necessary. If so, professional intervention may be necessary. Expanded practical strategies for managing childhood. OCD. Managing OCD requires structured intervention and patience. Here's what parents can do. Step 1. Reducing anxiety triggers. Identify stressful environments or interactions that escalate obsessive behaviors. Instead of constantly reassuring, help the child explore alternative thought patterns. Use storytelling therapy. Help children understand their compulsions by narrating them in a positive and constructive way. Introduce physical relaxation techniques such as breathing exercises or guided imagery to reduce stress. Step 2. Cognitive behavioral strategies. Gradually expose children to their fears in a controlled, supportive environment. Teach them to question their intrusive thoughts rather than automatically obeying them. Using logic-based corrections instead of forcing a child to stop washing hands excessively. Ask what the worst thing that can happen is if they don't wash them again. Creating reward-based encouragement. When a child resists an obsession successfully, reinforce their progress with praise or small rewards. Step 3. Building a low-stress environment. Establish a stable, predictable daily routine to minimize triggers. Offer alternative engaging activities such as art therapy, physical movement, or outdoor play. Encourage parent-child role-playing scenarios where the child practices handling compulsions in a controlled environment. OCD cannot be fixed instantly, but gradual behavioral changes and emotional support help children break the cycle. Parenting mistakes that can worsen OCD. Many parents unknowingly reinforce OCD habits. Here is what to avoid. Providing excessive reassurance, such as allowing repeated checking behaviors. Accommodating compulsions by making exceptions for obsessive routines. Punishing obsessive behaviors, which increases anxiety rather than helping. Ignoring emotional distress when children struggle with compulsions. Instead of reinforcing compulsions, focus on gradual exposure therapy and anxiety reduction techniques. Expanded real-life parenting success stories. Several families have successfully helped children manage OCD using these strategies. A mother who gradually reduced reassurance seeking saw her child's compulsions drop significantly in a few months. A father who encouraged mindfulness practices reported that his child's anxiety and obsessive habits became less intense. Parents who shifted focus toward creative play and physical activity helped their child develop a healthier approach to compulsive behaviors. OCD is manageable, and small victories lead to long-term success. Common questions from parents: will OCD go away on its own? While mild tendencies may fade, structured intervention significantly helps. Should I correct my child's obsessive behavior directly? Instead of correction, use gradual exposure and cognitive techniques to reduce obsession-driven actions. What if my child refuses to change their routines? Patience is key. Sudden changes increase anxiety, but slow adjustments make a difference. Conclusion: helping children navigate OCD with confidence. Childhood OCD is not a lifelong condition, but managing it requires structured techniques, emotional support, and patience. Parents must balance gentle guidance, cognitive strategies, and controlled exposure to empower their children. By implementing these techniques, families can help children break free from compulsions, develop confidence, and lead emotionally balanced lives. For more expert insights on childhood development, subscribe to Seeds of Tomorrow, where we explore science-backed strategies for parenting success.